I'm going to back up just a moment. Since you spoke all about the results volunteers, I would like to ask the results partners in the room to please stand up and be acknowledged. There you are. Okay. Another announcement I'd like to slip in here that I kind of forgot is that Julie will be selling her book, Everyday Justice, The Global Impact of Our Daily Choices, after the program's over. Our next speaker and final speaker is Eloise Sutherland. Eloise Sutherland and I have been working in results together for 17, 18? 17. Eloise is a retired accountant. She used to work for Jenny's Copying and Printing, who's also been a benefactor of results over the years, doing a lot of our printing for us. And since her retirement, she splits her time between her 7 grandchildren and full-time working to start new results groups across Texas. Eloise?
Wow. Thank you, Joss. Great story. I want to thank each one of you who have contributed to results in the past. You have made a huge difference. Let me give you a glance at what you have helped make possible. When I first became aware of results back in 1995, I had never written a letter to the editor, nor had I even thought of doing so. I had never called or written a letter to my member of Congress, nor had I even thought of doing so. I had not visited the office of my member of Congress to tell him what is important to me, nor had I even thought of doing so. And I certainly had never considered getting up in front of a group of people to give a speech. But here I am. One of the first pieces of information that I learned in results was that 35,000 children were dying each day of preventable disease and malnutrition. I was so cynical, I questioned how anyone could even know such a thing. Even when I was convinced that the information was accurate, I didn't think telling my member of Congress would make any difference. That doesn't sound like anyone an advocacy organization would want to recruit, does it? Well, results welcomed me and patiently supported me as I slowly, sometimes reluctantly, learned to be an advocate. I was asked to write a letter to my member of Congress. Results staff and other volunteers coached me and encouraged me. They provided a template and made suggestions. They kept checking back with me until I had completed the letter and put it in the mail. And you know what? I received a reply from a member of Congress. Writing a letter to the editor was even more difficult. It could only be 150 words. But again, results was there, coaching me and supporting me. I struggled and struggled. I began lots of letters that ended up in the trash. I submitted lots of letters that were not published. But one day, several years later, there in the Statesman was my letter. Wow. And since then, each year, I have a couple of letters published, sometimes in the Statesman, sometimes in other Texas papers. The results is always there supporting me in writing those letters. Results staff and other volunteers have challenged me, have guided me, supporting me as I've been asked to expand my advocacy efforts, speaking to members of Congress, building relationships with their staff members, writing op-eds, speaking to groups about results and our issues. Participating in results over the last 17 years has opened my mind to possibilities I never dreamed of before. It helped me develop skills I didn't even know I needed. Results has really enabled me to find my voice. Thank you for supporting results, so hundreds of volunteers like me received the training and the support needed to find the confidence to speak up for the poorest people in our world. Personal transformations like mine have been repeated hundreds of times and have resulted in amazing progress. Remember, 35,000 children were dying every day back in 1995. Well, just a couple of months ago, UNICEF announced that the number of children under age 5 dying each day has dropped to 19,000. 19,000 children dying each day of preventable disease and malnutrition is completely unacceptable to me. That would wipe out my hometown of Uvalde, Texas in about 20 hours. But that news means that 16,000 children live today who would have died back in 1995. More children are living because they are receiving a measles vaccine. More children are living because when they develop diarrhea, their parents know to give them oral rehydration therapy, a simple solution of salt and sugar and clean water that reverses their dehydration. More children are living because they sleep under bed nets, preventing mosquito bites that cause malaria. These are all things my results peers and I have campaigned for and have made a high priority for the U.S. Congress. And we have reason to believe that the pace of child survival will accelerate now. In the last few years, there have been some really amazing things happen, and I'll mention a couple of them here. First, 2 new vaccines have been developed, one for pneumonia and one for rotavirus. This rotavirus is an extremely virulent cause of diarrhea. These 2 vaccines are being rolled out right now in developing countries around the world. Earlier this year, Ghana was the first African nation to simultaneously introduce both vaccines. A clinic in Honduras reported no new cases of rotavirus the year after they had provided their children with this new vaccine. And there's a wonderful new mechanism for distributing vaccines to poor countries, and this is called the Global Alliance for Vaccines and Immunizations, Gavi. So Gavi brings together pharmaceutical companies and countries that need vaccines, building up the market and bringing down the prices. Last year, results members lobbied their representatives to sign a letter asking the president to make a 3-year pledge of $450 million to Gavi. At our request, Representative Lloyd Doggett from right here in Central Texas and 61 other members of Congress signed that letter. And the administration made their first ever 3-year pledge. And it was for the full amount we had suggested. The second reason we're so hopeful is that in June of this year, the governments of Ethiopia, India, and the United States brought together health ministers from over 50 different countries for a child survival summit. They were looking for a way to virtually eliminate preventable child deaths within a generation. 57 countries signed a pledge committing their support for a simple but audacious goal of ending preventable deaths by children by 2035. They went home and began immediately developing their own country plans for how they would accomplish this amazing goal. Just a few days after the summit had ended, we were hearing about Yemen producing their country plan. Yemen is an extremely poor country, filled with political instability, yet even they, like us, are committing to saving the children. Results groups produced at least 36 pieces of media about this summit, thus educating our communities and elected officials about this incredible opportunity. You can see the piece published in the Statesman right over here. Thank you for supporting results. Because of you, millions more children are alive today to celebrate their 5th birthday. Now, I ask each of you here today for your help. The truth is, that I would not be the advocate I am today if someone had not contributed to results way back when. Our wonderful staff members like Joss, who work with volunteers every day, the materials provided to our groups, our great website, conference calls, and events like our international conference are all made possible by contributions from people like you. Without financial support, quite simply, there would be no results. I'll let you in on some great news. In the last few weeks, we've already collected over $3,000 from our supporters who believe in our mission but couldn't be here today. So with deep respect and humble appreciation, I ask you now to help us reach our goal of $12,000 by making contributions to results that fit your means and are meaningful to you. For some of you, that may be $20, $50, $100. For others, it will be more, perhaps $500 or $1,000. Whatever you give, we promise to use strategically and wisely to help bring us closer to a time when poverty will only be remembered in museums and all children will have the opportunity to live up to their potential. We are grateful for your partnership and for you being here today. Thank you.
Thank you so much, Eloise. You'll find on your tables one envelope within which there are other envelopes. Those are envelopes that are donation forms. And I'd like to ask each of you to consider filling one out before you leave today. There's just a couple things I want to call to your attention. One is that you'll need to make a choice of whether you want your support to go to results or the Results Education Fund. The Results Education Fund is our charity arm, and a donation to it is tax deductible. So if you wish for your donation to be tax deductible, please select the Results Education Fund. Otherwise, you can select results. That's our lobbying arm, gives us more flexibility to do our advocacy work. In addition, okay, so we're getting the play-by-play up here on the screen. I can see that. Oh yes, the CVV code, if you're using plastic, be sure to use that as digits that are on the back of your credit card or debit card and put them in this lower right-hand place where it says CVV code. That's very important for processing your credit card or plastic payments. That, and I would encourage you to consider being a monthly sponsor. Monthly sponsor provides a secure foundation base for our work. And there's a checkbox at the very top for monthly sponsor, and then one of the last checkboxes down on the bottom half is about authorizing a regular monthly transfer of money. We really appreciate monthly sponsorships. So we will have volunteers available. If you have any questions, please raise your hand at your table, and we will come by and help you out. So thank you so much.
By and now to double across the street into a man sitting on the concrete, and I renew my body
me, are you